In this ultrasound video, we will compare the two kidneys, normal and kidney with parenchymal disease. This kidney shows enhanced echogenicity, which appears brighter on ultrasound. When we compare the right kidney, which is normal, when we compare the texture, this shows normal echogenicity. But on the left side of screen, the kidney shows enhanced echogenicity and cortical thinning is seen in this image. You can see this is medulla and this is cortex. Corticomedullary differentiation is normal, but in this case cortical thinning is seen and echogenicity is also enhanced. Now we will see how to measure the kidney. This is a normal kidney. We measure length. Normal diameter varies from 8 to 12 centimeter. Width 5 to 8, and CMD, for CMD measurement, this is how we measure corticomedullary differentiation. You can see this kidney shows 9.3, 4.2 and 1 mm, 10 mm. Now we will measure second kidney. 8.9, second measurement is 4.2, but when we measure corticomedullary differentiation, CMD, is 5 mm. So this is how we measure kidney. Now you can clearly see the normal kidney and kidney with parenchymal disease.